All right, so let's dig a little deeper into these vaccine mandates. Joining us now is Jim Tabery, professor of philosophy and bioethics at the University of Utah. Jim, thank you so much for being here and welcome back to the show.
Hey Rosie, good to be back with you.
So Intermountain just announced that vaccines will be mandated at their facilities. Can you talk about vaccine mandates on a sliding scale where some businesses are likely to institute a mandate more than others, such as a hospital? Yes. What about a tackle and bait shop, maybe?
Yeah, I think mandates are always contentious, but we should remind ourselves that they're not new. Even at Intermountain Healthcare, they've had a long-standing mandate where their employees need to be vaccinated against things like measles and hepatitis. Switch over to the University of Utah Health. They've had an existing mandate to get vaccinated with the COVID-19 vaccine for several months now. So, the idea that people who are working in hospitals, who are serving COVID patients, who are working with high-risk populations, that they would have to be vaccinated to protect themselves, other patients, and other employees is a pretty common idea, and I think we're just going to see more and more of that. As you pointed out, though, that when you move to a hospital or to something like a bait and tackle shop, that might change. And obviously there's going to be a variety of factors that employers are going to have to think about when they're trying to decide whether or not that mandate is a good fit for them. How big is their company? Do they have high-risk people that work there? Who do they serve, right? Who are their customers? Are they likely to encounter high-risk patients as customers? What's the environment like? Do employees have to work very closely together? Is it virtual? Is it all online? And there's not going to be one thing that fits. It's very likely that you could have a one tackle and bait shop for whom a vaccine mandate really makes sense. They want to protect the employees there who are high risk. And there's another tackle and bait shop that works purely through an online website, and it just doesn't make a whole lot of sense there.
So with the spectrum of groups that can impose mandates, where does government lie? And why is a mandate on government employees so contentious?
As you said, when you move from the private domain to the government, everything certainly gets more contentious. It's helpful to remind ourselves, though, that we live in a sea of government mandates. When I drove over to the station tonight, a couple mandates I bumped into. I couldn't be drunk when I got behind the wheel. I had to put my seatbelt on. I had to stop at red lights. Right? Those are government mandates. When my children went to elementary school and preschool, they had to be vaccinated before they entered that public domain. Those are government mandates. And so, we encounter these in all walks of life, but every time a new one comes along, particularly from the government, it can feel like things are getting very, very heavy-handed. And so that's why I think then when you're hearing about the federal government making mandates or state governments making mandates, where things seem especially contentious.
That is such an interesting but insightful way to think about it. Jim, let's shift gears and talk about the vaccine for kids ages 5 to 11. Some parents have said they want their kids to make the choice themselves, as they did. But what do you think about that? And you're also a parent as well.
I am a parent. I've thought about this a lot. We've talked to our children about it. I think a lot's going to depend on the age of the child, right? There are conversations and decisions that we let my 7-year-old daughter participate in that we don't let my 3-year-old son participate in. On the other hand, there are lots of decisions that we let both of them make decisions on. So, what Reading Rainbow episode they're going to watch in any given night, they get to decide. That's for them to call. There's also decisions that we don't let either of them make the final call on, right? They don't get to decide whether or not they're going to go to school tomorrow. That's just going to happen. In our household, something like getting vaccinated is going to be much closer to the you're just going to school tomorrow than it is what episode of Reading Rainbow do you want to watch. That said, that doesn't mean we don't involve them in the conversation and prepare them for what's going to happen, right? Just because we know ahead of time that my 7-year-old daughter is old enough to get vaccinated, so she will get vaccinated, doesn't mean we're going to sneak up behind her and jab her in the neck when she's not looking with a COVID vaccine. We're going to have a conversation about the importance of this. We're going to talk about how her getting vaccinated is about her protecting her little brother who can't get vaccinated. It's about protecting the other kids at her school who are high risk and would be really dangerous if they got COVID. It's about protecting her grandparents when they come and visit. And so it's involving them in a conversation, even though we know at the end of the day, right, we're getting to a destination.
So, Jim, what about anti-vaxxers, especially when the cases don't exactly, reflect what's going on? What do you say to people who are just in general anti-vax?
I think we have to be patient. This is all quite new. It feels like we've been in the pandemic forever, but on the other hand, this is rolling out very, very quickly. And so I think when you've got people that are vaccine hesitant, it's okay to create a little bit of space and give them time to acclimate. Intermountain Healthcare mentioned, they're going to implement that, but their employees have until January to get that first jab. So they've got time to get used to it. I think the hope is as time goes on, a lot of the hesitancy surrounding the COVID vaccine will subside as it just becomes clearer and clearer that it's safe. It's no longer in an emergency use authorization stage. More and more people will encounter others who have been vaccinated and they haven't turned purple, their limbs haven't fallen off. More and more companies will require a mandate and it will just seem normal. And so, I think it can be frustrating when it feels like people are operating with misinformation, but this is one of those things where as time goes on, I think time is on the side of public health. It's just going to become normalized.
Jim, we've got about 30 seconds left. In a 30,000-foot view of this issue, some argue that it is individual liberty versus public health. What do you make of that discussion?
Well, I'm glad you brought it up, Rosie, because that certainly is what it all boils down to. And so much of living in a society is about that individual liberty versus public health, right? I mean, questions about accessing illicit drugs, questions about who we're allowed to marry, questions about, seatbelts. When seatbelt laws first rolled out in the 1980s, many people across the nation were up in arms about the fact that somebody would, sort of infringe on their individual liberties and tell them they have to wear a seatbelt. But when things boil down to sort of how our actions interact with others, how decisions that I make impact others, not just myself, that's when the community good and public health becomes paramount. And so that's why we're seeing this shift towards things like mandates, because it's becoming just more and more clear that these vaccines are safe and they're effective and they prevent the spread of this deadly disease. And when you've got that as the alternative, giving up a little bit of individual liberty in order to contribute to that greater good, it's sort of a no-brainer.
All right, you've been hearing from Jim Tabery, professor of philosophy and bioethics at the University of Utah. Jim, thank you so much for joining us again and sharing your insight with us.
Good to be with you.
All right, still ahead, propose raised taxes on billionaires and large corporations. Details on how much they could increase and how much that could potentially raise in funding for provisions in the Build Back Better plan. And here's a live look at downtown Salt Lake City, a drier day compared to the rain and snow we saw earlier in the week. Chief Meteorologist Alana Brophy explains when the wet weather will return in Utah's most accurate forecast.